Hello, good evening, everyone. I welcome each one of you on behalf of Ignited Minds by PHF under the guidance of Dr. Liyakat Namole Sir. I'm Dr. Maneesha Soni and I'm your host for today's evening session. Today is our 46th lecture in the series of Guruji Ke Saath Guruvar. And it is my honor and pleasure, as always, to introduce the speaker for today evening. He is none other than Dr. Liyakat Namole, my friend, my brother, and my guide. I have known him since my college days. Sir has a wide and a very rich experience in the field of passionate homeopathy. And it is his dream to connect so many people and so many doctors to this method of learning, that is the mind method. And for that reason, he has delivered more than 300 seminars all across India, so that people can connect to this wonderful learning method. Also, he's taken more than 250 sessions in the online learning platform. He is the author of the book Humanopathy, which is, I think, one of the most simplest book, and I think every homeopath should have this in their library. And his lectures are so simple, easy to grasp. So today we are, again, very fortunate to hear another wonderful lecture from him. So without wasting any more time, let's welcome Liyakat Sir with a big round of applause. Over to you, Liyakat. Welcome.
Thank you.
Welcome, sir.
Thank you very much. You've been always so kind introducing me. Good evening, friends. It's a pleasure for me to be with you always. And I hope I'm audible.
Yes, sir. Yes.
Yeah, in the last session, we spoke about some parts of case taking, which I like to call case receiving always. Okay. What I went through Organon, I always go by Organon. I think there's no other book that can guide you more than Organon for case taking. And today I'll be speaking a part of some part of second prescription also. That I'll be taking lectures on second prescription after a while. Okay, but today I'll be taking case, and I'll be teaching about case taking. I'll be talking about case taking, especially for second prescription, or to make your plan of treatment, so that like to decide which remedy to be given first and then which remedy can come later on. Okay, by the rich experience of Dr. Hahnemann and then the other authors that I've gone through in my life. Okay, and my own little experience of 25, 27 years, and try to combine. And so the sole aim of our case taking, should be to get two things. Remember, one is to be able to get the deviation of health, okay, of the person. And second is to understand what has caused this person the particular sickness that he has come to us. Now we have been studying lots of remedies and lots of cases in mind. As in our lectures, we must have studied thousands of cases from different homeopaths. What we learn is how to prescribe what remedy you come to after taking the case, after understanding the mind. Okay, but we do not talk about the management. Okay, when the picture is very mixed, we are trying to, of course, during Hahnemann's day, there were few remedies. 400 some remedies must have been there during Dr. Hahnemann's era. I don't remember exactly, as I am not an academician. Okay, but there must have been something like 250, 400 remedies those days. So from that, whatever Dr. Hahnemann has understood, he has written in Organon. And now, even if I'm dealing with mind method, I deal more with the mind the disposition of the patient I'm trying to understand. Okay, like we have to understand the deviation of the health and the disposition of the person, the disposition of the health of the person. That is inclusive of his physical stature and then his mind and his nature in the so-called healthy state. Okay, that we try to understand. Now, from this, what Dr. Hahnemann has said in Organon, okay, is that the first prescription most of the times is antisoric. Okay. Now, the list of the antisorics Dr. Hahnemann has given in the book Chronic Diseases. There are some 40, 50 odd remedies. There are homeopaths who boast about to start the treatment with antisoric remedies that are given in chronic diseases. The book of Chronic Diseases by Dr. Hahnemann, they say that we have to start the case only by those remedies. But Dr. Hahnemann clearly states in aphorism number 208, sorry, I will tell you which is the aphorism where he says that the remedy, the most of the times, the first prescription is antisoric or the remedy which covers most of the symptoms of the case. In 209, in aphorism number 209, if you see what Dr. Hahnemann says, after this is done, the physician should endeavor in repeated conversations, mind you, in repeated conversations with the patient to trace the picture of his disease as completely as possible according to the directions given above in order to be able to elucidate the most striking and peculiar, the SSUP, what Dr. Hahnemann sir said, the peculiar characteristic symptoms in accordance with which he selects the first antisoric or other remedy having the greatest symptomatic resemblance. Please remember, Dr. Hahnemann says, very clearly says, the first antisoric or other remedy having the greatest symptomatic resemblance. So here he doesn't mean that we have to start the case by antisoric remedies. Okay, for the commencement of the treatment and so forth. Okay, so please remember, so don't make unnecessary assumptions that Dr. Hahnemann has said this and that. Don't make unnecessary assumptions. Please don't be prejudiced. What Dr. Hahnemann says, dare to be wise. So all these people who boast about purity and all the words they say about the way is very misleading. Now we have thousands of remedies that cover very many symptoms. During Dr. Hahnemann's time, there used to be remedies like, for example, now we have the rare remedies also proven of the same group, like Crotalus cascavella the other day I taught in the group. Okay, python, and there are so many. Like if you have the case of snake, let's say for example, the case seems like that of snake remedies, or say lachesis, or say let's think about sepia. Okay, if the case seems like sepia, but it doesn't have the dance of sepia, the dance with the sense of rhythm is what we have seen in repertory. The dance, the sense of rhythm with which sepia dances. Now the dancing is a daily core, the daily work that she does with a sense of rhythm. Means she does it with, she enjoys the work. She whether enjoys it or not, but she performs the work in such order that it doesn't seem like an exertion to her. She keeps on doing the works in such a rhythmical way that it seems as if it is such easy task for CPR to work from 5 a.m. in the morning till she sleeps late night. Okay, now sepia minus dance. Okay, sepia desires support when she becomes poor. She goes in the state of poor of her health, the poverty of health, where she starts getting irritated by exertion. There is a beautiful rubric in sepia, irritability, exertion flows. So exertion is a state of mind where the person has to put extra effort to do any work. Okay. When the work becomes exertion, it hurts you. It harms your body. It harms your mind. So when she becomes poor, when she is not able to work, when her energy goes down, there may be reasons, uh, uh, maybe giving birth to too many children, or there are things like, they have to work more, you know. So in that state, CPR gets irritated and then she desires support. Then she expects some support from her, especially from her husband, okay, or the people around, okay, who can really help her doing that. But when so CPR desires support when she becomes weak, poor. Okay. Now, if you want to, if there is a beautiful remedy called bambuza. Okay, where bambuza seems so much like sepia, so much like sepia. Okay, now when bambuza was not proven, when the remedy bambuza was not proved, that time we used to give sepia. The homeopaths used to give sepia. Now we give bambuza. Okay, when the dance is absent and the patient desires support throughout her life, because bamboo, if you see, is hollow. From starting, after the roots, when the bamboo is formed, it is hollow from within. Okay, so bambuza desires support from before. Bambuza at a state does not want to be responsible for the works, for the responsibilities as a homemaker, as a housewife. Okay, so this is where you differentiate. Now there is another remedy, Chironix fleckeri, which is also so similar to sepia. There are very few, very minor differentiation between Chironix fleckeri and sepia. So these remedies were not there. So those days, Dr. Hahnemann used to give sepia, then another remedy. So he is talking about things that we require multiple remedies at times. Not that he is wrong totally. Not that he is wrong totally. But now if we assume to start every case with antisoric from chronic diseases, the book chronic disease, and then we become very conformist and very stiff, that is going to harm the homeopaths and the patients in turn. Okay, so my request to everybody is to study repertory very thoroughly, provings very thoroughly, the remedies very thoroughly. Even if you don't know the drug picture of the remedies, doesn't matter. Okay, but you should know the rubrics, like the single remedy rubrics at least, or the characteristics rubrics, the characteristic symptoms of different remedies. We should know at least 70 to 80%, or say those remedies who are quite well proven. Those quite well proven, as in, if they have something like, for me, a remedy which is quite well proven means the remedy has 50 mental symptoms at least. Okay, that is enough for me to prescribe the remedy. So if the remedy has 40 to 50 mind symptoms, also I call it quite well proven remedy. Okay, I don't need 200 or 300 or 1000 or 4-5,000 mental symptoms like that is there in belladonna or sulfur. No, even 30-40 mental symptoms are there. They're quite enough for us to, prescribe it. Even if your first prescription fails or it works partially, then we go to the closer by remedies, right? So for this, Dr. Hahnemann has said to start, what the word Dr. Hahnemann is using here is the remedy, the other remedy having the greatest symptomatic resemblance. The greatest symptomatic resemblance, not all the symptoms present there. Okay. So what in spite of having repertorial knowledge or the knowledge of provings, of maximum provings, maximum remedies, if you feel that the drug picture is still mixed, then, my dear friends, mind you, the art of homeopathy comes into play very much. Art and science we have to combine. For this, the case taking which I'm telling today is going to help you very much, or maybe to a greater extent. So in that, we have to, for such cases, don't worry. Okay, don't worry. My experience is the cases where the pathology is very deeper. Okay, then you cannot cure the case. You cannot cure all the cases with one single remedy starting and that it ends the same remedy. No, not possible. Okay, so people mistake, where the patient's health is in a very good state. Okay, even if the patient's health is in a very good health, as in vitality is very good, in a very good state of state, and he does not acquire many pathologies from his ancestors, then even the cancer can be cured in such cases. But cancer of the same remedy with similar symptomatology might not get cured. The patient might just die in months' time, or some cases pass away after few weeks, few months. Okay, some die within a week or two. So don't get disheartened by that. That this in this case, in one case that you are able to cure the case or say prolong the life of the patient to years together, 7, 8, 9, 10, 12, 15 years altogether, even if the cases of cancer. And in some cases, you fail. But that's not failure. That is the limitation. Okay. You cannot pull the patient from a very deeper state of miasm, what Dr. Hahnemann calls syphilitic miasm. You cannot pull out the patient. I tell you, you cannot save anybody's life. You can make their life comfortable. Please remember that. You do not have cure for cancer in all the cases. You do not have cure for, let's say, interstitial lung disease in all the cases. No, not possible. Even some cases of ankylosing the rheumatic arthritis, where the joints are rheumatic, the arthritis deformans, you can't cure all the cases. You cannot cure spina bifida. Okay, you have limitations when the teeth is crooked. It comes like, horizontal instead of coming vertical. The molars, when they are like horizontal, yeah, if the patient comes to you very early in life, yes, you can help him. Like when the patient has milk tooths, like, milk tooth, and then the eruption comes, the teeth erupt to be very crooked, not straight. Then in such cases, you start the treatment. You can, in 70 to 80% patients, the later on teeth which are going to come will come proper. Even if you don't get the credit from the patient, doesn't matter. You gain confidence. But if the lady is coming at the age of 30 or say 24, 28, 27, 25, with wisdom tooth not straight, if it is coming horizontal or very crooked, you cannot cure that. You have limitations. Okay. So for this, the case which I'm going to tell will seem very much contrary to what I've been teaching to an extent. The PPP, yes, in acutes, yes, but especially in chronic cases or cases which has acute or a chronic disease comes to you, like the cases of, say, the patient has ulcerative colitis, and now this patient comes with fever. Now such case comes with malaria. Now such case comes with, let's say, simply loose motions or typhoid. What will you do? It's a big question, right? Or say tuberculosis, old tubercular patient coming with acute exacerbation. Say, let's say, is coming with what is it called as? What is it called as when the water fills in the lungs, the dropsy of lungs? What is it called as?
Pneumonia.
No, no, no.
Vision.
Pleural
Pleural
effusion. What will you do? What will you do in such cases? Very difficult to get PPP or concern adaptation reaction. Very difficult to treat such cases. Okay, my dear friends, my study, my last few years, say 2-3 years, I've been studying more on such cases and trying to find out a way. You know, Dr. Vijay has worked very much on this. Dr. Vijay has worked very much on this. But unfortunately, the people from mind method haven't worked much harder on this. Okay. So I will tell you what to do. The very simple, very simple things is you have to try to understand the deviation in the health. मतलब पेशेंट के रिश्तेदार आपको बताएंगे कि ये तो ऐसा नहीं था पहले. Okay. So now the deviation in health, the doctor will observe, the physician and the people around him, his friends, the nurse if the patient is admitted. Okay, his relatives will tell you about that. Okay. Second is we have to try to understand the exciting factor, what Dr. Hahnemann calls causa occasionalis. Okay. The fundamental cause, yes, is the miasm. Okay. Now for fundamental cause to understand, we have to take the family history of the patient into consideration and the past history into consideration. Both are very important. Family history, why? Because then you can prognose as to at what state you might have to change the remedy. At what state you will maybe again come back to the remedy that you thought of giving in the first place. Okay, for this, you have to take into consideration in detail the family history and the past history. And again, if the patient is presenting to you, whatever picture he is presenting to you, you have to confirm that. Please remember, you have to confirm that. Because if the case is coming to you after say 2 years or 3 years of going through lots of diseases, okay, and then if it's coming to you with despair of recovery, it is going to be a common symptom. If it's coming to you with the symptoms, but doctor, ये ठीक होगा कि नहीं पता नहीं क्या, मुझे नहीं लगता है ठीक होगा कि नहीं. I don't think whether this will get cured or not. So you cannot take the rubric doubtful of recovery because it is going to become common symptoms. Okay, so such thing you have to understand when taking the case. So for that, you have to confirm your symptoms. Like if you feel the patient is yielding, then you have to confirm that. You have to confirm that by putting him in different situations, by asking him questions about different situations, by asking his relatives. You cannot have the 5-minute, 10-minute case taking. Please remember that in every case, you cannot have that 4-minute, 5-minute, 3-minute case taking. No, you can't. Difficult. Okay, in 70 to 80% cases, yes, after becoming experienced like me, or say around at least 10 to 15 years of getting experience of 10 to 15 years, yes. But again, after giving the first prescription, you will require another remedy. You will require another. You are going to require remedies. Okay, you are going to require remedies in such cases. So be prepared to face another picture, be prepared to face another picture. Pictures after pictures will be coming to you. But there you have to, take into consideration what symptom of the patient has become better after your remedy. Okay. Like, for example, what Dr. Hahnemann talks in case taking. Okay. What he says is moral and intellectual character of the patient is very important. So if when the patient starts becoming morally better, like the other day on 1st of this month, in the group I taught the case of Protalus cascavella. That person was doing the business of money lender, was a money lender. And on huge interest, they used to lend money to people, say 10%, 15%, 20% at times. Like if you take a loan of 1 lakh rupees, you have to pay 20,000 rupees as interest every month. 10,000 rupees of interest every month. So don't take the rubric usurer there. Okay, don't take the rubric usurer. Because usurer is a person who lends money on high interest, is what is the dictionary meaning of usurer. Don't take that rubric. Take moral feeling want of greed. Okay. So first thing that should go in such cases, and wait, I'm telling you, have patience. Now this patient to whom I gave Protalus cascavella took say around 6 to 7 months, where he, stopped his business, not completely though, 10, 15, 20% still he has, but he's saying, I'm coming out of this, and he's searching for another business. Okay. Now the other cases, one patient I am dealing with is a case of fatty liver and diabetes and high cholesterol and submucous fibrosis. The man is around 70, 68, 70, very filthy rich. He drives that car. What is it called as? I don't know. The car is worth two or three crores. Okay. I don't know. शेर का पिक्चर होता है उसके ऊपर, वो गाड़ी चलाता है, बाल वाल उसने जाके इम्प्लांट किए. So I've been giving him Viratram album since so many times, so much of times, almost 2 years. After 2 years, 2 to 3 years, more than that, maybe before COVID treatment was there. Since then, he's coming to me. I'm putting him in Viratram album. Now he's on LM potency, I think 11 or 13, he must be on LM. Okay. Because I take lots of gap after giving the remedy. Now he has stopped alcohol. Now he has stopped after 5, 6 years. So don't expect immediately the person will stop alcohol, or he will stop smoking, or he will stop vodka, or because that is one of the obstacles of cure. Dr. Hahnemann has stated very clearly. So don't put that condition to the patient ki you have to stop alcohol, you have to stop this, you have to stop that. No, your remedy will work. Give it time. Give it time. Okay. So these so-called obstacles to cure also take time. Now, if there is quarrel between husband and wife, if the wife is in the rubric aversion to husband or hatred to husband, what will you tell? If the husband is coming home and doing cut, chick daily, he is being irritable with wife. The wife is like, say the husband is whatever the remedy. The wife is, let's say, Kapoor-Soni, or let's say, Dalkamara. What will happen? Will they take divorce? Will you ask her to stay away from the husband? No, you can't. But she will accept him after a while. If the wife is Kalikab, let's say, she will take time to realize, because she herself is a conformist patient. Alkamara has her own ego and her own independence and things to accept the husband, right? To understand his side of being irritable. It will take time. So just convince the patient to be with you for a while. Explain them that the remedy will work on the patient, how the body of the patient responds. That will tell the prognosis. Till then, they have to be with you. You have to convince them about not taking allopathy for, especially for acutes they suffer in between. Because if they take antibiotics and if they take anti-allergic and things like that, again they will go back to the first the thing that come to the malady that come to. Okay, so this thing is very important. Now, moral and intellectual character of the patient, you have to understand whether he has desire for life, like he has suicidal thoughts, then those thoughts should go first. Remember that, because love for life is at the top of every person. So when the person has despair, when the person loses the interest of life, that is the worst thing. So first that thing should go. Okay, so your remedy should cover that loathing for life, or say suicidal disposition or suicidal thoughts, let's say, right? Please remember that. So moral intellectual character, occupation of the person, in which occupation he is will determine his priorities. Okay, mode of living and habits is very, very important. Mode of living and habits, that will guide you to most of the times. Now, if the patient is chronic alcoholic, irritability becomes a common symptom after a while. Loss of sleep becomes common symptom after a while. Please remember. Okay, so that will take time. If he's drinking, he will take time. His insomnia will take time to get cured. And his social and domestic relations, the IPR that we are very fond of. Okay, the IPR, that is important for us. His age and his sexual functions. These are very, very important things. Okay. Now we have to ask very, very much in detail the previous treatments that he has gone through. I mean, the previous treatments he has taken is very important. And you have to focus on removal of maintaining factors, habits. Now, by counseling, one. Second, counseling as in not lecture, not giving lecture, but trying to explain him in his language. When the patient is in good mood, then you have to explain him to reduce alcohol, to reduce whatever, the habit of fine wine. And if you go through aphorism 208, and I've explained this maintaining factors in my Instagram handle, homeopathy 24/7. Okay, so read that. You will come to know what are the maintaining factors, what are the obstacles to cure. But now, if you see, even the habit of alcohol of the patient can be cured with homeopathy to a greater extent. And apart from that, you have to, give advise the patient to do yoga, or follow namaz, do regular exercise, depending on the faith he is following, whatever faith he belongs to, whether he's Hindu, Muslim, Christian, Buddhist, Jain. Okay, I have seen the prayers, they help a lot to the patient for coming out of such habits. But you can actually ask them to stop coffee and things like, especially if the patient, if it is antidotal to the remedy you are prescribing. Okay, and what I have understood in my life, what Dr. Hahnemann has also said, his state of disposition of the patient often determines the remedy. Okay, that is aphorism number 211. Okay, the disposition of the patient means his natural inclinations. Okay, his inclination, like whether he's inclined to do good things, whether he's inclined to be adulterous, whether he's inclined to indulge in reveling and partying and things. So his inclination, his disposition, whether he's a silent character, whether he's an aggressive person. Okay, so this type, the disposition, the mind often determines the remedy. Okay, now in the beginning only of organon, Dr. Hahnemann has said very, very clearly, he has stated what is to be treated in a patient. The physician should have knowledge of disease, the knowledge of his drugs. So knowledge of disease as in what exactly is to be treated in a patient. Just like I said, you have to treat his morals and intellectual character, his sexual functions, etc. Okay. So these things you have to understand first from the rubrics that we are going to take in the case. Okay. So be very, if you're lucky, you come to the moral and intellectual character of the person in the first sitting itself. Okay. You be bold to ask such questions to the patient. Talk to the patient along with his relatives first. Take his case. If the IPR is disturbing in between, okay, if the person accompanying is disturbing in between, be polite and say, can I talk to the patient in alone? Alone, like, या फिर ऐसे बोलो, मैं आपको सादा बोलता हूँ, मैं थोड़ा इनसे आराम से बात कर लूँ, थोड़ा ऐसे बोलो, तो then they okay sir, बात कर लीजिए. Some people, those who have big nose, those who poke the nose like SMS and sulfurs, and they say नहीं सर ये कुछ बात नहीं करता, इसको कुछ समझ में नहीं आता. So there you come to know. फिर भी हम बोलेंगे कि आपसे भी हम पूछेंगे. Okay, so that also you have to understand. When the patient, then you get very simple clue if the patient is speaking to you, whether the patient is able to communicate to you when he is alone, and how is he when the accompanying person is leaving the room, how is he when the person you call back and then talk. Okay, so his behavior when he was talking to you alone, and his behavior when sitting with the person who is accompanying the patient. Like if a small child is coming with dadi or chachi or dada, the mother is not accompanying. Or if the small child is coming with father, it indicates so many other things. Right? If the child is coming, if the small girl is coming with dadi or nani, okay, you can come to know the scenario in the house, that who is dominating, or whether the child is neglected by the parents. Right? So one very important thing I would want to read is from organon. Today my lecture might seem like a bit of that of academician, but I must share these things with you that I have understood. Okay, is footnote number 120, page number 245 maybe, but footnote number 120 is in investigations of the nature. Okay, because it deals with the case taking. Please remember, in investigations of the nature, we must not allow ourselves to be deceived by the assertions of the patients, or their friends, who frequently assign as the cause of chronic, even of the severest and most invertebrate diseases, either a cold caught through a therapeutic drinking cold water after being heated many years ago, or a former fright, a sprain, a vexation, sometimes even bewitchment, etc. These causes are much too insignificant to develop a chronic disease in a healthy body. Okay, so the so-called ailments from never well since typhoid, never well since pneumonia, never well since, these rubrics, you should abstain from taking. Okay, to keep it up for years and aggravate it year by year. Okay, as is the case with all chronic diseases from developed sura. Causes of a much more important character than these remembered noxious influences must lie at the root of the initiation and progress of a serious, obstinate disease of long standing. The assigned causes could only rouse into activity the latent chronic miasm. Okay, please remember this. One more para I would want to read is footnote number 140. The maintaining factors. But remember, these maintaining factors are now we have to see how the patient is taking care of these maintaining factors. Okay. Coffee, fine Chinese and other herbs, beer prepared with medicinal vegetable substances unsuitable for the patient's state, so-called fine liquors made with medicinal spices, all kinds of punch, spiced chocolate, odorous waters and perfumes of many kinds, strong scented flowers in the apartment, tooth powders and essence and perfume sachets compounded of drugs, highly spiced dishes and sauces, spiced cake and ices, crude medicinal vegetables for soup, for soups, dishes of herbs, roots and stalks of plant possessing medicinal qualities, asparagus with long green tips, hops and all vegetables possessing medicinal properties, celery, onion, and old cheese, and meats that are in state of decomposition or that possesses medicinal properties as the flesh and fat of pork, ducks and geese, or veal that is too young and sour viands, or just as a certainly of just as certainly to be kept from patients as they should avoid all excess in food, all excesses in food, and in the use of sugar and salt, as also spirituous drinks undiluted with water, heated rooms, woolen clothing next to skin, a sedentary life in close apartments, or the frequent indulgence in mere passive exercise such as riding, driving, or swinging, prolonged suckling, taking a long siesta in recumbent position in bed, sitting up long at night, uncleanliness, unnatural debauchery, innovations by reading obscene books, reading while lying down, onanism or imperfect or suppressed intercourse in order to prevent conception. Okay, the coitus interruptus, what we call subjects of anger, grief or vexation, a passion for play, overexertion of mind or body, especially after meals. Okay, so playing after meals, dwelling in marshy districts, dam rooms, what is the penurious livings, etc. All these things must be, as far as possible, avoided or removed in order that the cure may not be obstructed or rendered impossible. Some of my disciples seem needlessly to increase the difficulties of the patient's dietary by forbidding use of many more tolerably indifferent things, which is not to be commended. Like some people say, go vegetarian and go this, non-veg is bad, this food is bad, that food is bad. No, that is extreme. But now, if these maintaining factors are there, okay, and you tell them, some people you forget to tell. So if your remedy is, and if you're lucky, if the patient does not carry lots of load from his ancestors, like the family history, if there are venereal disease in the family history, or like I say, see the character of the father, okay, from what race he's coming to. Like we have, गांव में पटेल जो थे, गांव के मुखिया, previously they used to have, extramarital affairs, and they used to have keeps, sorry to say that word, but children of such, the parents, they might have got the gonorrheal trait or the syphilitic trait from the parents. Okay, so if such, luckily, if you don't have such patients whose parents' character were very clean and mashallah, good spiritually, in such cases, if you have these obstacles to cure, your remedy will make them understand and they will change their habits. Mind you, I have seen people taking divorce. I'm sorry. I have seen people making peace with their spouses. I have seen people becoming very spiritual. I have seen people, start doing exercise. I have seen people going to counselor. I have seen people going to gym, joining yoga classes, becoming very healthier after giving the right remedy, after giving the first prescription. I have seen these things happening, but not in all cases. This happens in 10% cases, or even sometimes 5% plus or minus, say five, say so 15% of the cases, max to max, these things happen. If somebody is boasting that he has such cases, he is lucky. I don't say he's wrong. I don't know, because the patients, you have to tell the patient that further in life, no problems, even if you don't come back to me, please go to homeopath. And whenever you go to homeopath, give me a call. I will talk to the homeopath and tell him that what remedy I had given and what remedy could possibly there be indicated as a second prescription, or maybe second prescription means later on might be required for the patient. Okay. So this is it. Any questions? I would, the viewers wants to ask some questions.
Good evening, sir.
Good evening.
This is Dr. Lata, sir. सर एक ऐसे पूछना था कि ऐसे क्रॉनिक केसेस में पेशेंट ऑलरेडी जिनको कुछ डायबिटीज वगैरह वो ऑलरेडी एलोपैथिक तो दे लेते रहते हैं, उसके साथ में जब वो होम्योपैथी स्टार्ट करते हैं तो ऐसा भी होता है कभी कभी कि वो पूछते हैं कि क्या हम आयुर्वेद भी ले सकते हैं क्या इसके साथ, तो व्हाट शुड बी योर सजेशन फॉर दैट?
I would suggest not. It depends on the case. If the patient is of cancer, then okay. And even in cases of cancers, you should see what drug they are giving. Okay. If there are too many, like combinations, then don't. If they're taking some dietary supplements, that's okay. But in rheumatic arthritis and other cases, no, not Ayurvedic. Not advisable.
Okay, thank you, sir.
See, we have diseases. Most of the diseases nowadays are metabolic diseases, right? Metabolic diseases are because of ill habits. Okay. Mostly the occupational hazards are also there, right? So people who need to work for night duties, so you cannot ask them कि आप सो जाओ, जिएगा कैसे? So in such patients, you have to have the knowledge of diet and regimen very well. So in such cases, diet will help very much. Okay. Such cases like diabetes is very difficult to cure in such cases, but of course, we have remedies for even such patients. Okay. As to what exactly is the adaptation of the patient, how he's handling things, what are his priorities, like whether family is his priority, whether he's being martyr or sort of thing, कि जाए सर बच्चों के लिए मैं सब मन मार के जी लूंगा एंड ऑल, ऐसा आर्सेनिक बोलता है बहुत बार. आर्सेनिक बोलेगा कि जाने दो सर, क्या रिकवरी क्या करना है ना, बच्चों के लिए करेंगे, अपनी हेल्थ तो क्या होगी जब खुद ये ठीक होगी, you know, the indifference to recovery of arsenic or a moonlight or calcaria, you know, or the being martyr of carcinosis or the of Macphos and Maxomica, you know, such rubrics come into play. We have to give this remedy in repetitions most of the times in LM potency, in repetitions for months together for the state of the patient to become really healthy, and the patient you have to suggest them to take naps in between or have good food or utilize their weekends or their holidays to lead a healthy life. At least they can compensate to a while in their holiday period. Any questions? I know today's lecture will sound little difficult, little indigestible to you people, but that is the hard fact of homeopathy, of being a doctor. Please remember that. Okay. Any questions? No, I think we should wind up, right? Either you people have not understood what I spoke, or you don't agree. Anyways,
Thank you, Liyakat. It was not at all difficult to digest. I think it was, at least it took me back to the initial case taking, and it was really very, very informative. I think it has helped us to revive the the case taking module. It very beautifully explained so many important points to be touched upon. So thank you very much. It was an absolutely fantastic session. Thank you so much. Thank you.
Thank you. God bless. Bye.